Everyone hates drains. Drains are probably the thing that patients complain the most about, but they play a very important role in breast reconstruction. When you are having a mastectomy with a tissue expander placement or an implant placement, typically plastic surgeons will use 1 to 2 drains. And the reason is we want to get rid of the fluid that your body produces after surgery in order to fill the wound and also get rid of any old blood that is in the breast after the surgery. Now, people might think, well, when you do a breast reduction, you don't use a drain. Why do you have to use it when you're doing a mastectomy reconstruction? The main reason is that when your implant or tissue expander is making its home in the breast, we call that the capsule. We want the capsule to be right around the tissue expander or implant, almost like a mitten would fit a hand. And the reason for that is that you don't want a big hole and then a small implant that kind of rattles around. So in order to do that, we need to minimize any excess space while that capsule is forming. Envision if you had an implant in your chest and there was a lot of fluid in the pocket as well, and then the capsule was trying to form. It would form too big. It would be too large for the implant. And then a lot of that fluid could even get stuck around the implant in the capsule and potentially lead to an infection. Now you might think, well, you don't use a drain when you do a breast reduction, so why do I have to use it for an implant? Once again, it's that capsule that's forming, the home for the implant. We want it to be very, very tight. Also, seromas or fluid collections have an increased rate of infection if they are associated with an implant. So if there's a fluid collection around your implant, it's a much bigger deal than a fluid collection, say in just a breast reduction or breast lift. One, I can just drain the fluid collection in a breast lift or a breast reduction. Much harder to do if there's an implant under there. And also bigger concern for infection if there is a foreign body like an implant or a tissue expander. I know that drains are uncomfortable. They're usually only in for a week or two. They serve a very important purpose. Did you know what the purpose was? If so, let me know below.